Welcome to welcome to the second part of our webinar series for female athlete triad. I'm Dr. Anisha. I work as a physiotherapist in ABFT Center in Pune. So today we are going to see the third part that is related to menstrual disturbances, which is one of the common thing observed in female athlete triad. So as we have already seen, female athlete triad is a combination of disordered eating, amenorrhea, that is menstrual disturbances, and osteoporosis. So this, as you have seen, is the new model which ranges from eumenorrhea to functional hypothalamic amenorrhea, that is a serious menstrual disturbance. Let's see what exactly a normal menstrual cycle means, or how much it should be, what are the phases that I included in the normal cycle. So the phase 1 is actual menstrual phase that typically lasts usually for 3 to 7 days, depending on person to person. The phase 2 basically includes the follicular phase, which is ranging between 15 to 16 days. Typically, it lasts for 16 days. It starts from the first day of ovulation, that is the woman's periods. And in that, the FSH, that is the follicular stimulating hormone, is released from the glands. Okay. Then it goes to the phase 3 part, which is the ovulation phase, which lasts typically for 3 to 4 days, in which luteinizing hormone, which is the main hormone responsible for keeping all your levels of FSH and estrogen in normal levels, is released. Okay, and that helps in rising the estrogen level, and that causes ovulation, which happens around 14th day. Then comes the last phase, that is the luteal phase, wherein there is rise in progesterone level, and there is slight increase in the estrogen level, which is more than the normal range. And then again, there is a drop in the cycle, wherein the cycle resets. And then you start getting your PMS symptoms, and then again, it comes to the menstrual phase. So on an average, this has to be a regular menstrual cycle, which should last for about 16 days, 3 to 4 days, and 11 to 17 days. Now, what happens, or what are the menstrual disturbances that usually occur? So they are typically divided into two different types. First is amenorrhea. Now, amenorrhea is again divided into two different phases. First is primary, and the second one is secondary one. So primary means no menses till the age of 15, which is very common thing seen in athletes. The secondary type is loss of menses for more than 90 days after the menarche has begun. So again, these two types are commonly seen in athletes. Either they complain that the cycles are too long, or the cycles are too delayed, which is the first alarming sign of menstrual disturbances. Second disturbance, which is common, is anovulation, that is absence of ovulation, which is typically known as oligomenorrhea, that is menstrual cycle interval for more than 35 days. So if this particular thing is observed, that the cycle is getting delayed, you should immediately start tracking your menses to keep a hang of it, that how much delay is happening in your cycles, what are the symptoms, whether it is something which is happening very frequently, or whether it should be reported or something like that. Now, what are the reasons for menstrual disturbances? The primary reason is hormonal change. So the first common thing is suppression of gonadotropin releasing hormone. Basically, it is responsible for secretion of luteinizing hormone, which we have seen, which is very important in your luteal phase. That is the second phase. Okay. Now, if there is suppression of gonadotropin hormone, of course, it is going to reduce secretion of luteinizing hormone, resulting in failure of ovarian stimulation and reducing level of estrogen and progesterone. If that happens, then there is a change in your cycle, and that is where you will find menstrual disturbances happening. So there are, this is the primary reason. There are secondary reasons because of which you can see menstrual disturbances. The three main things are psychological stress. It might be related to your family pressure, it might be related to your performance pressure, it might be peer pressure, it can be anything, or it might not be anything related to an athlete's sport, but it can be something which is very personal. So the second part is body fat disturbances. So it might be because of your unhealthy eating, and because of which your body fat keeps increasing, ultimately causing an effect on hormones. And third is again GnRH suppression, that is due to low energy availability. Now again, all these three being related to each other, they are of course going to be uh, it is of course one of the reason for this particular thing is low energy availability causing uh, issues with your energy availability and release of hormones. Okay. Now, what are the complications of this particular thing? What all things can go wrong is firstly the endothelial dysfunction. Now, what happens is because there is hormonal change, your endothelial lining starts increasing in size, or it becomes thicker and thicker, which is not good for a regular menstrual cycle. That if there is a endothelial dysfunction, then it can also lead to your PCOS, your causing infertility. All these things are related. Then other complication is low bone mineral density. Again, it is related to your hormone releases. Elevated cholesterol levels because of low energy availability, your lack of exercising, menstrual disturbances, your cholesterol level is going to go high, and ultimately it is going to affect your body. Stress fractures is another thing which is very common in athletes because hormonal changes are not just disturbing your menstruation phase, but they are also going to affect all other hormones. It is going to affect your vitamin D and calcium absorption, which is ultimately going to lead to stress fractures because you end up reducing your exercise intensity. And last but not the least is decreased immune response. Now this, we have already seen what are the manifestations of the triad. So there are different things like weight loss, anxiety, depression, nutrition deficits, constipation, slowed growth, impaired athletic performance, which is very common in athletes because of all these uh, accompanying factors. Now, how will you diagnose that there is some menstrual issue going on? So first and foremost, if talking to someone whom you trust is very important. And if it is a physio, if it is a coach, or if as a parent, it is essential that you will understand what is exactly going wrong. So the first part is taking menstrual history. As a doctor or as a physio, you should always question them as what's the age when they first got their periods, how long is the cycle usually, how long the cycle usually lasts, what are the symptoms that they get, is there any delay or have they experienced such a thing before. Then secondly, hormone profile. Now this is something which is usually advised by the gynecologist because it is a way out to understand what is going wrong, which hormone needs to be taken care of, and how it needs to be treated. Okay. So the first part of it is screening. As I have mentioned, menstrual history. So age of menarche, frequency and distribution of the cycles, longest period of time without menstruation is very important, and last menstrual period. So both these things are going to help us in understanding as to what is exactly going wrong. What are the changes that are happening? Then physical signs of menstruation. So other than getting a normal backache or cramps or feeling of fatigueness, apart from this, there is a thing called as cervical mucus change, or because of that getting menstrual cramps. So apart from a normal menstrual cycle, are you finding any discharge during your menstruation is very important to be seen and to be noted of, because that is something which is going to suggest of underlying pathology. And was there any hormone therapy that was taken before is something which you need to be very clear of when you are approaching a gynac or when you're discussing this thing with a coach or your physio. Second part of screening is exercise history. So during your menstrual phase, how have you been exercising? Were you putting too much pressure on your body? Were you not exercising at all? Or how have you been managing the exercise? Was there any fracture during this particular time? Is very important because, as you know, the triad is related. So one symptom is going to tell us or give us an idea about something other happening, which might be your primary cause in that particular athlete's injury or delayed healing process or lack of performance. So now testing. Usually a gynec will or a doctor will refer you to do a hormone profile, which basically includes testing of all your hormone levels. Because one hormone is related to other. If there are fluctuations in your levels, then that is something which needs to be treated medically. It cannot be treated just by doing non-medical interventions. So now management. So first part of the management will be menstrual disturbance related management. Mainly it will be done by a gynec. I think gynecologist is the best person whom you should refer before taking any therapy by your own choice or before approaching anyone else. So what all usually includes in menstrual disturbances management is athlete education is first and foremost, because you need to make that person aware of what exactly is happening in the body, what is going wrong, how he or she needs to tackle it. Okay. Resumption of menses should occur through restoration of energy availability. Now, this is something that means you shouldn't stop eating. An athlete should never stop eating because they are having a particular eating disorder or maybe menstrual disturbances, because that is a myth. If you don't have enough energy with you, there is no point of doing anything because you will not have enough capacity in yourself to give you 100%. And that is where you will eventually land up in even more trouble. The third part is pharmacological treatment. Usually it is the hormone replacement therapy that the gynecologist will suggest. But again, as I said, it is best to consult gynec in first place if you notice anything that is going wrong with your menses, because they will be the one who can guide you appropriately as to what to take, what to avoid. The last part is stress relief, which is one of the reasons for disturbances. So maybe you can go for your yoga classes, you can go for meditation. Apart from that, if there is too much of psychological stress for you, can consider going to a psychologist for counseling. Now, in general, how should female athlete triad be treated? It's mainly pharmacological, secondly nutritional, third is psychological, fourth is gynecological, and fifth is physio. Because physiotherapist is usually a bridge between all the three things, because we need to be aware of what you are doing, how we should divide your exercises, how your performance should be targeted. Now, how to prevent female athlete triad. What you should do as an athlete. Every girl should first of all monitor a menstrual cycle calendar. Just very important. Athletes usually try, or maybe normally girls usually don't record their dates, which causes issues in diagnosing the menstrual disturbances. If you are regular with your tracking, it is easier to track it and diagnose a particular problem at an early stage. Secondly, consult a physician if you have irregular cycles, or consult a gynecologist if you are prone to injuries, if you are getting fractures on and off every few months. Thirdly, talk to counselor if you are overly concerned about your body image. Now, this is something which every girl is usually under pressure of because of peer pressure, because of society, as to if she is looking, if a particular person is looking thinner, okay, she is looking like that, I'm not the way she is. So this is something which is very wrong, and you should address this issue at a very early stage. Fourth part is see a sports nutritionist to tackle your nutritional disorders, because they will guide you in a proper manner, in a scientific manner, as to how to treat the nutritional deficits as per your sport. Last is seek emotional support from your coaches, because or teammates or guardians, because they are the one who are always going to be there with you, around you, and you should first go and report it to your coach. if there is anything that you want to discuss related to a triad or a symptom that you're getting. Now, this is something which your athlete should do. Now, if a coach is involved in, what a coach should ideally do. Always remind your athlete that eating on time is important, eating appropriately is important. You shouldn't ever promote this as a fact key, okay, don't eat if you are not wishing to. You, the athlete should always have their own nutritional content uh, in a specific way or in a certain level, which should be maintained and that should be guided upon by a coach. Secondly, focus on healthy body image and not on weight. If an athlete complains that I'm putting on weight, always counsel them that it is about maintaining a certain image or a certain composition rather than maintaining low weight or being slim and trim. Third is support athletes through their training and everyday life. If an athlete is going through a lot of pressure or they are discussing certain issues, as a coach, you should always support them positively as to if they are not willing to do a certain thing, give them a rest day or advise them to take appropriate rest whenever necessary. Have available resources such as nutritionists, trainers, or counselors wherever you are practicing, so that it's easier for an athlete to go approach them anytime when they wish to do it. So that's the end of menstrual disturbances. Thank you so much. And this is what the female athlete triad includes in general. And every athlete should be aware of how they want to screen themselves, and they should be aware of these particular things whenever they are stepping into a competition phase or athletic training. So this is something which is very basic knowledge that they should have. Okay? Thank you.